Dr. Cook, thank you so much for joining us here on Health Connection. Real pleasure to have you. Our topic is children's nutrition. What they eat matters now and later. And that makes sense. Nutrition affects all of us, but why does what children eat now matter later?
Well, I believe that their habits that they start now are ones that are going to follow them into adulthood. So if you're able to train your children to make good choices at this point in their lives, then they won't have as much trouble choosing healthier foods over the more advertised, more highly advertised, unhealthy foods that are constantly out there at every turn.
In America, obesity has become epidemic among our children, causing all kinds of problems. Discuss the short and long-term effects of poor diet that leads to obesity in children.
So the short-term effects include the children not being able to function as well in school and in athletics because the foods that they eat aren't fueling their bodies well enough to do the things they need to do. So they may be tired, too tired to perform their duties in class, and then if they're trying to exercise in PE or do sports, then they may get more winded than their peers. They may have a harder time with their flexibility, with their skills, and not be able to excel like they want to if they're carrying extra weight or not fueling their bodies as well. And then for the long term, these children could be looking at developing high blood pressure, diabetes, cholesterol issues as a result of putting in foods that aren't being used by their bodies in healthy ways. So their bodies end up storing this as fat, turning it into sugar. Then their pancreas gets overloaded. They could end up with diabetes. Same thing with cholesterol. That cholesterol builds up on their arteries and could lead to heart attacks, could lead to lots of damages that would affect their long-term longevity.
There's research that says that poor eating habits can begin as early as infancy. Arterial plaque buildup now being found in very young children. Is this totally attributable to the types of foods that children eat, or is there something else at work?
Well, diet plays, I think, the larger role in it, but some children are genetically predisposed because their parents may have had it or their grandparents. And so in those cases, if there's a family history of high cholesterol or high triglycerides, any of those things, then that's something that's important for the families to let their doctor know so that their physician can know what tests to order at what times to make sure we can catch those things. But the diet does play a large role in the progression of those high cholesterol and high triglycerides that would lead to those children developing long-term effects such as heart attacks.
All right. Let's just talk about some foods that children should avoid and why they should avoid them.
So foods that are high in saturated fats, foods that have any trans fats whatsoever. So it's just important to look at food labels and to check to see how much saturated fat and how many trans fats are in food.
Give me some examples.
So for instance, potato chips, anything that's fried, whether it's French fries, whether it's chips, whether it's foods high in, that are highly processed. So pizza in large quantities, stuff that's coming out of the vending machines, whether that's at school or elsewhere. Those things tend to have a lot of saturated fat, trans fats, sodium in them, and so it's important for children not to have those on a regular basis.
I think we all remember our parents trying to get us to eat foods we didn't want to eat. You know, and the argument that it was good for us, didn't hold a lot of water. What advice do you have for parents with respect to getting their kids to eat foods in a way that they'll actually eat good foods?
So one big thing that they can do is to incorporate their children into the process of preparation. So buying recipe books that are children friendly or specifically for their kids and allowing them to help with the food preparation so then the children actually feel invested in the prep process. That goes a long way with them actually wanting to try foods. And another thing is just trying foods slowly. So introduce a food at one dinner time, maybe not the next, and then try it again in a couple of days in small amounts, and just encourage them to try foods. And if you continue to do that in small amounts without forcing it on the children, then it gives them the opportunity to develop a taste for it rather than to avoid it or to hate it because they were forced to have it.
All right. We hear a lot about the food pyramid, but do you have any specific recommendations for a healthy diet plan that parents can provide for their children?
I basically recommend just downsizing your plates at home and filling the plate with half fruits and vegetables, and then do a portion of starches. So if you have a plate here, you cut it in half. You do fruits and vegetables on one side. You do a quarter of lean meat and then a quarter of starches. And that's an easy way to be 100% sure that your kids are getting enough healthy stuff in their system without overloading on the unhealthy stuff.
You mentioned earlier that some health issues can be attributed to genetics, such as heart disease, diabetes. We know that there are genetic predispositions to these kinds of conditions. Can a genetic predisposition for a disease be curbed or delayed by following a healthy diet?
I believe so. I believe that modifying the diet and exercising can help to either delay the onset, prevent the onset altogether, or in a patient who has already been diagnosed with one of those things, it can help them to not have to take medication. So for instance, exercising 30 minutes per day, 5 days a week, and getting 5 to 9 servings of fruits and vegetables, eating lean meats, avoiding lots of fried foods, lots of sugary sweets, a lot of sugar in the drinks that the people are consuming would help significantly in lowering their risk of ultimately developing that disease or having an uncontrolled disease process.
If there's a family history of, say, heart disease, how early should children be screened?
So if there's a strong family history, and if the children are obese most especially, the children may need screening as early as 2 years old. The American Academy of Pediatrics currently recommends that kids get their first screening for cholesterol between ages 9 and 11, and then again between ages 17 and 21. But in a child who has a strong family history of high cholesterol, heart disease, elevated triglycerides, and obesity, and if any of those things are already showing in that child, then we would recommend starting them sooner and perhaps screening them more often, so that if they were to develop those conditions, we could start the modifications of diet and exercise and potentially medication if necessary to get those children back to a healthy level and prevent heart disease.
How important is it for parents to find a medical home for their kids in order to identify early any potential problems?
It's very important, and here at UT, as well as other places all across the state, all across the city, all across the United States, there are facilities available to help take care of these children and any needs that they may have regarding their health. And so it's very important that we have checkups with these children at least yearly, but in the event that they struggle with childhood obesity, with their cholesterol, with any other disease processes, then we may want to see them sooner, like every 3 to 4 months, perhaps every 6 months, to make sure that we're monitoring them closely, starting medications, recommending therapy, monitoring their weight, so that these things don't become problems that they deal with well until adulthood.
Very well, Doctor. Very interesting. We appreciate it, and thank you for your time.
Thank you very much.